Welcome to the deep dive. In health services research these days, there's just, an explosion of data, right? Big data.
Absolutely, just mountains of it.
Yeah, patient information, socioeconomic details, where people live, work. It's a lot. And the challenge is, how do researchers sift through all that? How do they find what's really important for, say, figuring out who's most at risk for a bad health outcome?
Right, it's that classic too much information problem, isn't it? But, scaled it for research, if you just dump thousands of variables into a predictive model, well, often you just get noise, messy results.
Unreliable.
Exactly. You need a smarter way, a structured way to pick out the variables that actually tell you something useful.
And that's exactly what we're diving into today. We've got a source here, a paper that really maps out a process for this variable selection task. So our mission is to unpack that, how to pick the right data to get insights that are not just accurate, but actionable.
Okay, yeah, let's get into it. So the first step, and it's crucial even before you think about which variables, is pre-processing.
Cleaning the data.
Basically, yeah. Cleaning house, you've got to look for things like variables where most of the data is missing. If you don't have the info for most patients, well, that variable is not helping much, is it?
Right. Or variables that barely change.
Precisely. If everyone has pretty much the same value, it doesn't differentiate anyone. So, yeah, get rid of that kind of noise first.
Okay, makes total sense. Clean first. Then the paper talks about bringing in human expertise, like manual selection.
Yes, absolutely. And this isn't just like random guessing. It's driven by knowledge. Researchers use their expertise, what they know about, say, health disparities or how a disease progresses.
From theory or past studies?
Exactly. To actually handpick variables they suspect are important. This is super important for stuff like social determinants of health or SDOH. Income, education, transport access. Things an automated method might overlook, but an expert knows are probably key. It's the art, you could say.
The art guiding the science.
Right.
Okay, so after that initial expert selection, then you bring in the more analytical tools.
Right, that's where you start refining. A really common tool is the correlation matrix.
To see how variables relate to each other.
Exactly. It helps you spot multicollinearity. That's when two variables are so closely linked, they're basically telling you the same thing. Think income and poverty level, maybe?
So you'd pick one, the most relevant one, probably.
Usually, yes. Avoids redundancy. And the paper we looked at, they mentioned using a pretty strict cutoff, like 0.6 correlation, because they had hundreds of these SDOH variables. You need a high bar.
Gotcha. They also mentioned techniques to reduce the sheer number, like PCA, principal component analysis.
Yeah, PCA. It's a standard dimensionality reduction technique. It can combine lots of related variables into fewer components. Good for cutting noise. But interestingly,
Yes.
the authors of our source didn't use PCA for their main variable selection.
Oh, why skip it? Seems powerful.
It is powerful, but it makes the results harder to interpret. The components PCA creates are mathematical mixes, They lose their direct real-world meaning.
I see. And if you're trying to figure out which specific social factor or health issue is driving risk?
You need that interpretability. You need to be able to say, okay, this factor is the problem, so you can design an intervention or explain it clearly. Losing that link makes it less actionable.
Okay, that makes perfect sense. Actionability depends on understanding the... What about other methods then, like random forest or lasso? People use those a lot for selection.
Definitely. Random forest is good. It gives you a ranking variable importance, helps you see which features are pulling the most weight overall. And lasso, that's the least absolute shrinkage and selection operator.
Sounds technical.
It is a bit, but it's really useful with lots of variables. It basically penalizes complexity and can shrink the influence of less important variables right down to zero.
So it effectively drops them from the model for you.
Exactly. It selects variables by forcing some out, giving you a simpler, potentially more focused model.
And the case study in the paper, the one on cancer treatment disparities using all that detailed SDOH data, that really pulls it all together, doesn't it?
It really does. It showed that whole systematic flow.
Right.
Start with the pre-processing, then the manual selection based on what's known.
Using expert knowledge.
Right. Then using the correlation matrix for those tricky SDOH overlaps, and then employing something advanced like Baruda, which is actually based on random forest, to really nail down which variables are statistically relevant and not just, chance findings.
They also mentioned CART, classification, and regression trees.
But not for selection.
Right, they used CART later more for what they called phenotyping.
Phenotyping, what's that mean here?
It's essentially about identifying distinct patient groups.
Right.
Based on combinations of their characteristics, especially those SDOH factors, you can see which combinations are linked to different outcomes. CART builds these, like, decision trees.
Visual maps. Yeah, visual maps that make it easier to see how complex interactions, different mixes of social factors actually predict different health trajectories. It makes the subgroups interpretable.
So when you pull it all together, this deep dive really shows that effective variable selection, especially in health research, it's not just about plugging data into some black box algorithm.
Not at all. It's
Yeah.
really a structured, thoughtful process. You absolutely need that human insight, that domain knowledge, especially for complex things like SDOH. But you combine that art with the science of these powerful analytical tools, correlation, Baruda, lasso.
To find that sweet spot.
Exactly. The sweet spot between prediction accuracy and, crucially, interpretability, so the findings can actually lead somewhere, lead to targeted actions, better interventions.
Absolutely. And it makes you think, doesn't it, in this world just drowning in data, where else could this kind of careful blend, this balance between human expertise and these smart automated tools uncover really vital insights that we might otherwise just completely miss?